My comment to anyone who hasn't been to the dentist for a while, whether it's fear, whether it's embarrassment, please come in because you will be welcomed. We will never make you feel ashamed or guilty. We want to understand what we can do to help. We're here to help. And when you come in, we're always going to take the time to listen, find out what your needs are, find out what your wants are, and we'll come alongside and advise you the different options and then work towards a plan that makes you happy. And that's our goal. And we try to do that with everybody. Yeah, if you haven't been to the dentist in a while, what I'd encourage you to do is come and see what advancements have occurred. Technology has changed so that we can do dentistry differently, we can make it comfortable, and most importantly, we can give you education so you don't need all the dentistry that was needed in the past, frankly. So come and see what technology improvements we have in iTero here, and that's a way to really look at things differently and be proactive versus reactive. Yeah, so coming in for cleanings, it's interesting because most patients say, hey, I'm going to come in for a cleaning, twice a year. What's interesting about twice a year cleanings is there's no scientific basis for that. Some people can come in for cleanings once a year. Most people need cleanings 3 times a year, and it's dependent on what needs they actually have from a gum health perspective. Twice a year was a Crest commercial many years ago, and there's no science behind it. So what we do is we look at everybody individually and say, okay, what do you need? Because I have some patients that do such a good job at home, they only need to come in once a year. I have some patients that don't have any cavities, so why am I taking x-rays every year? So it's individualized to what your needs are. So when you come in for a cleaning, know that we're going to be looking at a number of different things, but in the end, we're going to do the treatment that you need, including less x-rays and sometimes even less cleanings if you're doing a really good job at home. So it's important for you to understand you're not just coming in for 2 times a year cleanings, you're looking at what an individualized treatment plan would be for you.